can we zoom out and just, I think we need a bit of epistemology in this field. We need to know what we're doing, and that's still missing. And so pretty much everyone, if they're not clued in, they look at an EEG and feel pretty much abandoned and having to produce all these goods, which is a report. And that's quite threatening. We cannot forget that we are psychologists, or I am, and I look at it from that perspective. So if we pull back and you think, what is happening here? There's so much confusion in this field. And if you allow me, I would maybe make some contribution towards the clarification of that problem. And if you look at it from the neurofeedback field perspective, you see the niche of neurofeedback. And then you see another sub-niche of QEEG. And lo and behold, there's so many problems about, these two niches are often not talking to each other. And I think about it a lot about these things and ask myself, why? And I read and I try to come to a conclusion, why do we have this? If you go, and I think it's lack of direction. I'll give you an example. If you look at the EEG at the hands of neurologists, they're very clear in what they have to do and with what they want to do with the EEG. And that was defined decades ago. Epilepsy, epileptiform, tumors at the time, sleep stuff, etc., all of that. You come to our field, which is now, when I started, we had almost nothing. If you look at the publications since then, I arrived in neurofeedback in 2009, more or less. And the number of publications per year were very, very slim. If you look at PubMed now, it's just exploding. And there's a reason for that. That happens after the not so known decision by the INMH, the National Institute of Mental Health, of saying, guys, we're not funding any more research with DSM. Sorry, we need to look into neuromarkers. Well, and what do we have with QEEG? We have a tool that is able of digging out. It's not perfect. It's limited. Every method is limited. It's going to give us a lot of data about brain functioning or brain dysfunction. But then pull out, and we have this problem, is that there's a fear about facing raw data EEG. And I see two main elements here. And remember, Nikki, I hope I'm bringing this fresh perspective, which is let's call it an European perspective. And I always remember Jay Goldman telling me, Jay saying, we have a problem in the field in the US because we're all hippies at the time. And now people only remember that. And it's been kind of, it's difficult to get out of that. Although today, the quality of research is huge. But you see a lot of research, much more research coming from Europe and the rest of the world than from the US. And you ask yourself, why is this? So that's one aspect. If you come, from my side, and my tradition is, we are lab-based at university. I had a lab, the QEEG and Brain Research Lab. We do research, not so much in the US. Now jump to the clinical side. Clinicians are much more comfortable, as you were saying earlier, with automated systems because they believe that, they trust someone to organize all of this. And then, by the way, just a sub comment here. Oh, AI. And I was very happy to see Yuri Kropotov saying it's a fad, as he says. It is a fad because we've had AI on EEG for a long time. What do you think ICA is? It is AI, but it is limited. We need
actually, ICA is a supervised machine learning algorithm, which is a step below AI, but it's similar.
Yes, but you probably agree that we need some clinical eye to understand. But I'll come back to this in a second, just to say
we do.
So people rely on these automated systems or the turnkey systems, and that is on the way of the three words I use when I talk about these things, which is, if we want to progress as a field, a field that is expanding towards neuroscience and leaving the niche mentality, we need quality, we need precision, and we need autonomy. Quality is the gold standard. So all this confusion about neurofeedback QEEG, I'm sorry, guys, QEEG is the gold standard of neurophysiological assessments, with a long history in psychology, by the way, that most people don't know about. So let's hang on to that gold standard as a beginning of an assessment of that brain. I'm very, at times, upset with this hack mentality and this little gadget stuff. And would you give your son, your mother, your father to someone who works with hacking and small devices? Probably you wouldn't. So are we lying to ourselves in pretending that we can go ahead And handling the brain without a gold standard, technique like the QEEG or others to assess the brain, I leave the question in the air. But the problem is we have two obstacles. One, I propose, is that we had a huge development in the field called neurometrics. And neurometrics means two things. It gives the EEG a specific use, which is you're using the EEG during sessions because you're plugged to a database, a normative database, and that's based on the concept of neurometrics, and that has limitations. It was a huge development at the time, huge, significant, beginning with the work of the phenomenal Roy John. But then you have to think that the comparison to the norms is still somehow a normative concept. And you look around yourself, and where do you see normality these days? And as you know very well, only 5-10% of ages will be normal. Mine isn't. Is yours? Right? So there are some difficulties in the concept of neurometrics at the cost of upsetting a lot of people who have their hearts in the right place, but we also have scientific development. So neurometric is this concept that allows you to compare to a database and trust a database, but that's still a hint of a DSM concept, isn't it? Norms. And that has, the issues that we know. That's one issue. The second then will be our fear to face an EEG. And the main problem I find, as you were saying earlier, is the artifacting. How do we do it? Oh my God, what am I doing? Am I taking too much, too little? But this is the autonomy aspect of what I was saying earlier, quality, precision. And autonomy is we have to have full access to the data. And that's what we bring from an European perspective, lab-based, where I've always had full, I work with the MITSAR, I would have to work with anything, but my courses are completely machine agnostic, equipment agnostic. And because of the software, that allows me to do a number of things, but we always had full access to the data. And if you work with, what do you call them, a turnkey system, an automated system, you never have access to the data. Now, what's the huge implication of this? It is that without full access of the data, you don't create critical mass. You don't develop as a clinician. So if you ask me, is the QG for everyone? Probably it isn't, but that's fine too. So having said that, we have now this gold standard, which could help us go from a niche perspective into the main arena of applied neurosciences. And now we have to decide, what do we want as a field? We need to discuss these things. Do we want to take the high road, equipped with the EEG, QEEG, gold standard, listed in the RDoC framework? That's a very important detail. And use that, learn that, come up with the goods, add value with that equipment, and sit at the main table of neurosciences? Or we prefer to stay in the smaller niche, very respectable, very nice, very wonderful people, but we stay outside of the big debate, because the big guys look at us and girls look at us, oh, who are you guys? EEG, what is this? All that conversation. So if we could decide which way, and of course, is it going to be more difficult? Yes, it is. We need more commitment. We need to look at more data. We need to get used to it. But it's not difficult if you know what you're doing. So this is the big idea driving the work that I do. And actually, you ask, how could we leave the niche? Nothing against the niche, by the way. I'm just saying that we could, smaller to bigger. We need to train psychologists. Why is that? Let me explain that. Because if you go to the RDoC framework, you see that all of a sudden, this is stuff I have to pinch myself. When I was starting in psychology, we had nothing. We had the biomedical model. What do we have now? We have developmental aspects in the RDoC framework. We have lifestyle. We have a number of things. All of the aspects of assessment are within psychology. And psychologists and mental health practitioners, we have an idea of development and the impact. So we need to stop looking at the brain as this two-dimensional thing and create a third dimension, which is time, development. Happened to me at age 7 or 6 or whatever is now playing up in my brain. So this is just to initiate our debate here and hope, to bring some fresh ideas. Not so fresh, by the way, because I think we have great hopes with using QEEG in mental health for the benefit of many.
Yeah, and it's interesting, that was a novel concept to me that neurofeedback and QEEG were different,
They're not.
right? Because it's like, well, if you're going to a clinic and they're going to do a map at the beginning and they're not going to be looking at it themselves and they're not sort of trying to do the detective work of like pursuing what it is that's happening in this person's brain, and they've sort of outsourced their own protocol generation. Why would you go to a clinic? I started as a DIYer. I bought my own neurofeedback device because I heard about it on a podcast. And so I was just, kind of, this was 10 years ago now. Um, and yeah, of course, there are limitations to that approach. Like, I didn't really get results. I didn't really get like a program that was catered to me. And that's sort of what led me to trying to learn more and get greater expertise and like go beyond just sort of like playing with toys and like working with professionals. But to an outsider, I don't think it, or even just a newcomer, it's non-intuitive that within this field, there's a lot of not just sort of disconnection, but on some level, like antipathy between folks who are just proponents of a particular neurofeedback model and folks who are interested in EEG, QEEG, ERP for the broader value that has in mental health. Um, and I don't know how cynical to be about that.